question. The question is, what is the acceptable ratio of admits to non-admits? And I will tell you, that's always been something that I think that you've got to historically track. So it's really hard to say what's acceptable or non-acceptable, but it's so critically important to know what has your history been. Like, how many referrals are you getting in? What is that conversion rate from a referral to an admit or a non-admit? And where are you trending? Or is it trending that it's getting more, less? Is it trending up? Is it trending down? And what are then the steps that you're going to take to improve it? And is whatever those steps are, is there something in place that's allowing you to track if they're working? So it also could vary depending on territory. So what I mean by that is, like, I have one area that is a very rural area. And if I get a referral and it's an hour, 15 minutes from the agency and it's going to need daily wound care, I may say, because of using judgment, that I don't have enough staff that's easily available to go that far, that, every single day. It may be a better decision for me, so that my staff doesn't get mad at me, to say, you know what, we're not going to admit that patient. But is it because of other reasons, where there wasn't enough staff working on a Saturday? There wasn't enough staff to assign and open cases on a Sunday. So you got to dive into your data and really understand it. So when we actually look at our non-admits, we put them into 5 different buckets. And I had just done this because we just had our Department of Health survey this week. So I had to report on how many non-admits we had and what were the reasons. So, like, we had to report on how many non-admits were because the patient ended up back in the hospital, or the patient moved out of the service area, or we had to deny them because of a payer, or we had to deny them because of a location, or, we had to refer them to a different provider just because we didn't have enough staff to safely admit that patient on services. So I think you've got to look at your data, and you've got to really determine what type of a situation are you dealing with. Like, one of the things that we do every month is we look to see, is there ever a non-admit because of a payer? And is it that we don't have a contract with that company? And is that a contract we want to go after? Or is it because we don't want a contract with that payer? So there's so many different avenues to look at. Don't forget, it's not just, your rep obviously wants to have every patient admitted. I mean, I know most reps want everyone to be turned into an admission, but you also double check whenever you start to have a slide in non-admits. Look at your staffing ratios. Because I will tell you that if you go back through my company's history, every time that our non-admit rate increased, it was directly correlated to the number of nurses I had available to do admissions.